Hi there, I'm Dr. Andrea Shanowski from Health and Horsepower, and I am here today to talk to you about the top reasons that I see for back pain in my office. So everybody knows that pinched nerves in your back caused by joints that are out of position that are pinching or irritating your nerves can cause back pain. But a lot of times we see patients that are coming in with muscle and ligament sprains and strains from overuse or injury, but arthritis can also be a big factor, as well as disc injuries like disc bulges or disc herniations. Now, it's really important to understand that on a daily basis, you need to be doing stretching to keep the joints and the muscles nice and loose. We also want to make sure we're doing exercise to strengthen the muscles of our core and the muscles surrounding our spine at least 3 times a week. But you also need to make sure that you're engaging in chiropractic care to get your spine checked, to make sure the joints are moving properly and we are keeping those joints moving how they're supposed to prevent arthritis in the first place. Now, if you're a woman, there's 2 more factors you may not have known about. So the first thing is when we are under stress, your body is going to deplete magnesium levels a lot faster. Now, this is true for men and women because when magnesium levels plummet, that's going to cause your muscles to be more hyperactive and they're going to tend to tense and spasm a lot faster than if you had sufficient levels of magnesium. Now, the other thing when it comes to stress is stress also depletes some of the hormone precursors that help with joint stability. So if you're a woman and you're under chronic stress, what can happen is that stress is actually going to steal away some of those hormones that help with your joint stability. And that's going to cause joint laxity that'll predispose you to having joints shift out of place much sooner. We're also going to have higher levels of pain response. So when your hormones are out of range, you're going to notice that you feel that pain response a lot more. So when you're under stress and those hormones are getting stolen away, that's going to cause your pain to be a little bit more severe. And the number 2 reason that women tend to have more issues with back pain and notice that it's affecting their lives more is because when we look at hormone change, yes, even if you've been through menopause, even if you've had parts removed, you're still going to have hormone changes that are cyclical that happen throughout the month. So when we have those hormone dips during our menstrual cycle, or if you're through menopause, if you've had parts removed, you're still going to have some of those cyclical changes. Typically, when we see those hormone dips, that's again going to cause some of that joint laxity that can predispose you to having those joints move out of position, causing pain, but also cause when those joints are not moving properly, the muscles have to work harder. So we're going to be working those muscles much harder, and that can cause those muscles to spasm and also cause ligament injury a lot sooner. Now, if you are a menstruating female, or you're currently pregnant, you're going to have more of an issue with this because typically the week before your menstrual cycle is when those hormones are changing so much. So typically we're going to have, and I see more patients coming in my office with headaches and back pain related to menstrual cycle about the week before they start. If you're currently pregnant, those hormones are at very high levels, so small dips can really be a big effect for you, causing pain. So if you are currently menstruating or the week before your menstrual cycle, that's the most likely time that you're going to have some hormone factors that could be causing more pain for you. And if you're currently pregnant, that also can be a factor because those hormones are changing on a regular basis. Now, one of the things I do want to kind of focus on is the fact that when patients or when people in general are having back pain, they want answers. They want to know, why am I having this back pain? What can I do about it? But also, what can I do to prevent it from ever coming back? That's exactly what we do and what we specialize in my office. I want to make sure we sit down with you to find out what the problem is. So we're going to actually evaluate your joints. We're going to evaluate your ligaments. We're going to evaluate your nerve function. We're going to evaluate your muscle function and your posture to make sure we know exactly what factors are a problem for you. And in many cases, I do also ask about hormone balance. I do ask about your menstrual cycle because I want to know if we tend to have issues before menstrual cycle, because we may need to look a little bit deeper at possible hormone imbalance issues or potentially how we should be managing stress and magnesium levels to make sure that your body is in the best possible place to prevent back pain. The other thing I do is after I do that exam, if I find things on your exam that are showing that we have an issue, I also can do x-rays on site. So we can take a look deeper into the joints to see if there is arthritis. We can see if there's any disc damage that's been done so that we can really figure out how do we get this stable to relieve your pain, but also how do we actually retrain the muscles and ligaments so we can reduce and stop that arthritis from getting any worse and potentially start working on rebuilding the cartilage and strengthening those muscles to restore normal curves, restore normal joint motion, and make sure those muscles are doing their job and not just sitting there drinking Mai Tais, not holding your spine and joints stable. But the other thing I do is I actually start treatment typically on day 1, which means not only are you going to get answers, you're going to actually start getting treatment so we can get you results as soon as possible on day 1 to get you some relief. So if you're ready to schedule an appointment, you can check out our website, freedompeoria.org. There's a book now button to schedule or request an appointment, or you can give our office a call, 309-689-6200. Have a great rest of your day. Hopefully you learned something today. And if you have questions about hormone testing, you can also set a appointment request on our website. Again, that's freedompeoria.org to find out a little bit more about how we can help or even do a consultation to talk a little bit about your hormones and how that could be affecting your health and specifically back pain.